I'm really curious, Governor. As you're running for president, what are your thoughts about reforming, the public health authority in the United States and the federal government, the CDC, the FDA, the NIH? How do you see the reforms we need so that the mistakes of the lockdowns that happened during the pandemic don't happen again when there's another pandemic?
Well, first, we need an honest reckoning about what happened during COVID. And the only honest reckoning is that all of those agencies, all of the elites, the public health establishment, they failed. They instituted bad policies. Obviously, it's a novel virus, but I think what happened was when the data was becoming more and more apparent that the path they were on was wrong, they doubled down and wanted to do it even more. And I really believe had Florida not just kind of stood in the way, I think this country would have had rolling lockdowns for probably a 2-year period. And so their impulses were authoritarian. They were not following the data. And I think the U.S. government needs to acknowledge the failures. And I think all of those agencies need to be cleaned out. What I saw just dealing with them was I saw a interest in the narrative and in politics over evidence-based reasoning and evidence-based medicine. And so I don't have confidence that those agencies are up to the task. And I think you need major overhaul of the whole enchilada with respect to public health in this country.